Now that we're done with the actual student nurse checklist, what we're going to be doing now is the newborn care checklist. So similar to actual care, let's assume that I have a PPE gown donned, but I do not have one right now. Same reasons, because I couldn't find one. So but I have my mask on, my hairnet, my face shield, and my sterile gloves. Now the first step is we're gonna on these procedures we're gonna call out the time of birth and the gender or sex of the baby.
Baby delivered at 3:45 p.m. It is a boy. It is a boy.
The purpose of this is to input data on the client, and as well as on the baby. At the same time, we're gonna put an identification band on the baby, not just one but two identification bands, one on the arm and another one on the leg. The purpose of this is to so that nurses could be aware of how the baby went out, what's the gender of the baby, the name of the baby, and who's the mother of the baby. At the same time, nurses would be aware on what type of medication that they're going to be giving the baby. And once again, two identification bands on the arm and the leg. It's because this is to avoid, let's say, because there are some cases wherein the identification band slips off. So at least you have an extra one in case one slips off. So after calling out the time of the baby and identifying the gender of the baby and putting on the identification band, what we're gonna do is we're gonna be delivering the baby into the abdomen of the mother. At the same time, while doing this, we're going to be assessing the APGAR score of the baby. So the purpose of assessing the APGAR score is for in cases of interventions that may be needed. If the baby has a, a, APGAR score of 8 or higher, we don't need to have that much of interventions. But when if there may be problems that may be encountered, that's where encountered through the data of the APGAR score, that's where we're gonna be using it. Next is we're gonna perform the thorough drying of warm cloth on the baby. The purpose of this is not only does it protect the baby from cold or hypothermia, this also stimulates breathing to the baby. And and after thorough drying of the baby, what we're gonna do is a part of the procedure of unang yakap. We're gonna have to do is early skin to skin contact. The purpose of this is it technically provides warmth to the baby, to the mother. At the same time, it's also a bonding. It's a bonding method for the mother and the newborn infant, and at the same time, it's an immunoprotection for the newborn from hypoglycemia. After doing early skin to skin contact, we're gonna have to start the procedure of properly cord clamping. And here are the procedures. First is we're gonna have to wait for 1 to 3 minutes of the pulsations of the cords before we can cut it. Purpose of delaying cord clamping is to increase the infant's blood volume and iron reserves, and this also reduces anemia of iron deficiency. So we should also remember we shouldn't be milking the umbilical cord back to the baby. The purpose of this is when the umbilical cord is let's say the pressure or the tiny blood vessels can rupture the brain of the baby, and it can increase hemorrhage, and as well it can increase hemorrhage. So after so those are the and so now the next thing we're gonna do is cord clamping. We're gonna be clamping the cord 2 centimeters from the base, which is the baby's stomach. And then what we're gonna be doing is we're gonna give another extra space for 5 centimeters from the first clamp for the first clamp. So I couldn't find a clamp, so I just use this. I just use this because I couldn't find one, and I can't go out since AUP regulations, you know. So we clamp on the the clamp two. This is 2 centimeters away from the base, as you can see, 2 centimeters from the base, and from the first clamp we're gonna get a Kelly, and we are going to clamp. We're gonna clamp. We're gonna clamp the umbilical cord. So after clamping the umbilical cord, what we're gonna do is we are going to be cutting. We're gonna be cutting the umbilical on the first clamp. Although we should remember, usually if the baby is premature, they would give more extra clamp space or more than the usual normal one. And from there, we should remember not to apply any alcohol or Providone iodine. The purpose of this is so it can naturally dry or heal itself in the proper healing way. And at the same time, alcohol, especially for ethyl and isopropyl, contains some agents that may that may be harmful for the baby, and can also usually delay cord drying by a day or two. So after cutting the cord, what we're going to be doing is we're going to be examining the number of blood vessels in the umbilical cord. As you can see, we should check if there are 2 arteries, 1 and 2, this small one, 1 and 2, and there should be 1 vein. The purpose of this is check if there's any congenital malformations. In reports, a significant number of these infants have congenital anomalies, particular to renal and gastrointestinal malformations. So to observe this is to check if the baby has any abnormalities. As you can see, 1 artery, 2 artery, 1 vein. So after cord clamping, what we do is non-separation of the baby with the mother. At the same time, this is the initiation of breastfeeding, wherein the baby will just find its way to the mother's nipple and start breastfeeding, wherein breast milk is actually recommended by the World Health Organization that babies should take it, because this is a healthy nutrient, especially for newborn babies. At the same time, this is technically like their first immunity medication. Let's say vaccine or immunization for them. At the same time, breast milk can also help eliminate pathogens, or can also make the baby strong. So after breastfeeding, the first implementation of breastfeeding, the next thing that we're going to be doing is we're going to perform a complete physical assessment or examination on the baby. The purpose of this is to we're gonna have to examine if there's any that there may be any crucial problems that the neonate may experience. We're gonna be checking on the cardiorespiratory status, the thermoregulation, if there may be presence of any anomalies or abnormalities. We're gonna be checking whether the client can breathe well, if the client has trouble breathing, oxygenation. This at the same time, what we're going to be doing is we're going to also, if this procedure is also going to help us evaluate the newborn's maturity and the well-being of the client. So the first thing that we're going to be doing is we're going to be performing the anthropometric measurement. We're going to be measuring the baby's weight, height, head circumference, the chest, as well as the abdominal area. The purpose so that we can have data and data to check if the baby's statistics are on a normal range or in a healthy range. Next is we're going to be performing eye care. We're going to be using ophthalmic ointment or erythromycin, or we're going to be using this. We're going to be performing this to it helps prevent ophthalmia neonatrium on infants. At the same time, it can treat eye infections on babies. So here's what we're going to be doing. We're going to start from the inner to the outer of the canthus and apply 1 cm ribbon to both eyes. And this is where we're going to start our medication, or when we're going to start injecting medications on the baby. First is we're going to have a set of 3 medications, which consists of vitamin K, hepatitis B, a vaccine, as well as a vaccine. So here's how we start. First, we're gonna be injecting the client with vitamin K on the vastus lateralis, or in the left anterior lateral and the left part of the thigh. The scene in the video. This to prevent The purpose of vitamin K is to prevent or treat hemorrhagic diseases in newborns. The next one is we're gonna be injecting the baby hepatitis B vaccine. This time on the right side of the thigh. The purpose of this is for immunization against infection of any types of virus, especially for the hepatitis B viruses. Next, we're going to be injecting the baby with TB BCG vaccine. The purpose of this is it's going to be on the deltoid, the side of the baby. So the purpose of this is to prevent severe TB in infants, neonatal immune system, and still immature. This protects the newborns from serious forms of tuberculosis. So yeah, we're gonna be injecting the client with that. And after injecting the client with these medications, what we're gonna be doing is we're gonna be assessing the vital signs of the baby. We're gonna have to observe the baseline data from the we're gonna be checking on the data from the time we injected the medications and so on. And after giving the baby medication, what we're gonna be doing next is we're gonna let the baby room in with the mother. The purpose of this is for the mother to develop the confidence to to care for the baby. At the same time, it also allows mothers to read the baby's cues, to know if the baby is sleepy, to know the baby's hungry. It's technically to help the mother be more aware or more knowledgeable on or bond more, understand more her baby, and so that when she leaves the hospital, she won't have a difficult time reading the baby, or explain to the mother the subtle cues so she could understand the baby, and at the same time should be more knowledgeable on how to handle it. So what we're gonna be doing is after that, after letting the baby have a room in with the mom, we should keep the mother and the child with a skin to skin contact. So what we're gonna be first doing is we're gonna be covering the baby and the mother with a blanket, as well as the baby with a bonnet. This enables the baby's colonization of newborn maternal flora to protect against infection, and at the same time it promotes breastfeeding, like I mentioned a while ago. This also prevents hypothermia and stimulates hormones to support breastfeeding and mothering. So you should also remember you should keep the baby's temperature range at around 36.5 to 37.5 Celsius. Temperature. The purpose of keeping the temperature at a normal range is we can check if the baby is experiencing heat loss, or if the baby is experiencing hypothermia, wherein these problems may cause these abnormal temperatures may give us interventions on how we can treat or intervene on ways to do it. For instance, a baby might get too cold and may experience hypothermia, and all that. Next is we're gonna have to postpone bathing until the 24 hour of life, or earlier than 6 hours of life. So the purpose for postponing the baby bath is if you bathe a baby right away before 24 hours, or earlier than 6 hours of life, it make because the baby's skin is so fragile and so sensitive that when it hits water, it may develop hypothermia, and at the same time, this can also increase the risk of infection on the baby. Uh, it can also can have coagulation defects. At the same time, acidosis delay to fetal to newborn circulatory adjustment, and surprisingly, I just realized this, it can also cause some hemorrhages. And from there, we have to always remember to minimize the handling of the baby. We should inform the healthcare workers as well as the family members to strongly, wash their hands. At the same time, arms, elbows, the proper antiseptic techniques before handling the infants. The purpose of this is to prevent transmission of infection or bacteria to the baby. Now, after that, what we're gonna be doing is we're gonna be assessing, or we're gonna be watching closely on the baby if the client is having a difficulty breathing. We're gonna have to check on the skin tone, if there may be signs of jaundice or cyanosis. Next is we're gonna also check if the baby has feeding problems. Abnormal observation should be referred to the. So if we find any abnormal observation, we should refer this to the primary care provider. And for the purpose of this is for immediate care and management on the newborn. So after doing all that, what we're gonna do is we're gonna start documenting the assessment of the newborn, the therapeutics that we did, interventions that we did, and measures that we've done on the parent and on the patient. The purpose of the infant chart is it's an important piece, especially when it comes to documentation, because it serves as a baseline for infants' health status. At the same time, it provides information measures done to the newborn, and at the same time, this is also for birth record documentation. So that is the assist, actual, and newborn care checklist.